Okay, welcome back, everybody. So today we're going to be talking about another depressing topic, which is euthanasia and related issues. So a few things first. So there are a lot of different terms that you'll hear, right? So you'll hear euthanasia. I'm sure you've heard this. There's also medical assisted suicide, maybe physician aid in suicide, or physician assisted suicide. Then there is also few other ones, right? So there's medical aid in dying is another one. Um, it's important to note that these are different terms, right? Or these mean different things. They're oftentimes used semi-synonymously. Sometimes people will just use different terms based upon their political leanings. So, for example, sometimes people will say medical assisted suicide when they actually mean euthanasia, just because they're more left-leaning, or medical aid in dying because they're more left-leaning, more liberal, and they want this to be permissible in some sense. But in a technical sense, these are different terms, right? And it's important to go over them. So um, euthanasia is just essentially the hastening of death to provide relief from suffering. I'm going to spread these out a little bit here. All right. This is what euthanasia is. Euthanasia literally comes from Greek terms, which put together means good death, right? So like that's the actual origin of it. Um, and with euthanasia, there are a couple different types of euthanasia, which we should get into. So the first type of euthanasia is passive. And passive euthanasia occurs when a physician lets somebody die. Um, An example of this would be somebody who's on life support, and the physician unplugs them from their life support, and then they go ahead and die. The physician themselves is not actually leading to the physical causes, or it's not actually causing the death. I mean, maybe in some accounts of causation they are, but it seems like, or the thought behind this is that the physician themselves is not causing the death or helping cause the death. They are merely preventing the continuation of life. Um, and some people think that's a morally relevant difference. Some people don't. We'll talk about that a little bit. And then there is active euthanasia. And active euthanasia occurs when the physician, in some way, contributes to the death rather than letting something else happen. Okay. Now, there are three types of passive or active euthanasia, I should say. Let me just add some arrows to make sure um, this makes more sense here. Okay. Three types of active euthanasia. So the first type is going to be voluntary. And this occurs when the patient themselves gives consent. Okay. The second type is non-voluntary. And it's just the opposite of voluntary euthanasia. It happens when the patient does not give consent. This is pretty much illegal everywhere. Okay. And then the third type is involuntary. I know it's kind of hard to remember the difference between non-voluntary and involuntary, because generally those terms would be synonymous. And involuntary euthanasia is when the patient can't give consent and somebody does it for them. We can think about a patient who is cognitively impaired. We can think about children to some extent. Um, and where in these cases, their family or their next of kin, they would give the consent to the doctors, or maybe in some cases, the doctors themselves or a court may take action. This is what involuntary euthanasia is. I hope you guys can see the difference between non-voluntary and involuntary euthanasia, right? Non-voluntary kind of presupposes that the patient in some way could give consent, or at least there isn't somebody who could give consent in the situation. When involuntary says the patient themselves can't give consent, but we can defer consent onto somebody else. You can think about situations where uh, somebody essentially has to ask the next of kin whether or not they want their patient or they want their family member to continue to be on life support. The same thing is happening with involuntary consent in this case, right? Where um, the patient themselves can't give consent, but we can defer consent to somebody else. Okay. Now there is, let's go into these other top categories. So there's medical assisted suicide, right, which is uniquely related to or um, is a separate thing from euthanasia. And medical assisted suicide is when um, uh, 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 the physician helps the patient commit suicide in some sense, but does not do it themselves. Kind of standard cases of this is going to be a physician providing the patient with some sort of pill. Um, and this needs to be in cases of like suffering and terminal cases. Medical aid in dying is, from what I can tell, it's a broader term than medical assisted suicide. So it just means any sort of medical aid in dying, right? But for this point, for this lecture, we're just going to be talking about euthanasia and medical assisted suicide because the distinction is pretty clear between the two of them. Okay. So I want to talk about some kind of general arguments for and against euthanasia. And then I want to go into maybe some of the gray areas if euthanasia is permissible. Okay. There's really one main argument for euthanasia, or for the permitting of euthanasia. All right. And it's going to be something like this. We can think about situations. There are plenty of situations which happen, and they're absolutely terrible, where there is a patient who is suffering some sort of terrible illness, and it is causing a mass amount of suffering. Oftentimes, these are terminal conditions, meaning that the patient's going to die in the near future, anyways. Um, and the basic argument is we can either let the patient die a very slow and painful death, or if they so choose, we can essentially speed up the process so that they can, uh, to some extent, live in dignity, or die in dignity. Now, this seems, right? I mean, we can just call this like the dignity argument, right? Um, there seems to be some pretty good reasons to support this, right? So we talked about the four basic principles in medical ethics, right, which are broadly accepted, right? That is autonomy or respect for autonomy, which is just essentially the idea that we should let patients decide for themselves. Um, you have the principle of non-maleficence. This means that we should do no harm to the patient. We have the principle of beneficence, which means that we should essentially benefit the patient. And then we have the principle of justice, which generally talks about equality and fairness and stuff like this. You can take these principles and make arguments from them, right? So we could very easily say that if you have a patient um, who wants to go through with physician-assisted suicide or euthanasia, um, then listening to them would essentially count or be respecting their autonomy. Or you could even say, plausibly, that you are not respecting their autonomy if it is broadly illegal. Of course, physicians can deny care for somebody, so perhaps we could just view it as that. But we could maybe think about this as taking away somebody's autonomy, taking away their autonomy to die in a dignified fashion. Um, Now, in one of the videos which I posted by Peter Singer, he's a very famous ethicist and youth activist for euthanasia, also an activist for animal rights. He goes over some of the reasons, or a lot of the common reasons, why people decide to go through euthanasia or medical assisted suicide. And actually, one of the reasons is that people start to lose their autonomy when they suffer from these terminal conditions. And this can take away a lot of dignity. It can make people um, very unsatisfied with their lives. So you could also essentially say, well, if we want to respect autonomy, um, then we need to recognize the fact that the patient is already losing their autonomy, or in some cases, the patient is already losing their autonomy when they have one of these terminal conditions. Okay. Um, we can also think about the principle of beneficence. So, it may very well be the case that the patient's condition is so bad that they would be um, better off if they decided to not live anymore, if they weren't living anymore, than if they were living. Now, this is highly controversial. Some people would think that that is impossible, especially people who have religious commitments, especially towards the sanctity of life. But it's a plausible argument. Now, the two other conditions are a little bit less clear, right? So we have non-maleficence and we have justice. For one, justice is kind of just broad, or it's kind of vague. It's harder to define justice. Um, you could definitely make an argument that it would be unjust to not allow euthanasia. Perhaps you could go ahead and say something like, there are plenty of people who are going to die peaceful lives, and then there are people who aren't going to die peaceful lives due to things completely outside of their control. Thus, we would actually be making the world more just and more equal if we permitted euthanasia in some cases, right? That's a very plausible argument. Um, Non-maleficence is a little trickier because you can view the killing of a patient, no matter what the prior conditions are, as being something that is inherently harmful. Um, you could also essentially view non-maleficence as pretty much just the opposite of beneficence and say, no, we're just trying to make sure that the patient receives as little bad, as little badness as possible. And maybe beneficence is saying we need to make sure that the patient receives as much goodness as possible. Um, Principle of non-maleficence is sometimes thought of the principle which is do no harm, which is commonly cited to come from the Hippocratic Oath, and this was essentially just a set of commitments that doctors needed to follow in ancient times, I believe in ancient Greece, and people could plausibly go ahead and essentially say doctors have a duty to not harm the patient, um, unless harming the patient would take away some greater harm. And there's no greater harm than death. Um, I don't necessarily agree with that, but that's an argument that you can make, and thus the euthanasia violates the principle of non-maleficence. Okay. In general, there are going to be, right, a few different conditions which need to be met in order for euthanasia to be considered permissible in regions where it is considered permissible. Or let's put this down as common requirements. Okay, here we go. Okay, the first requirement is that the patient needs to be terminally ill. To a lot of people, it seems worse to kill someone who is not going to die than it is to kill someone who is going to die anyways. That's the very basic reason for why we would want to have the terminally ill requirement. The other one is that the patient needs to consent, or there needs to be someone with the ethical ability to consent for the patient who will consent for them. Um, Oftentimes, we would go ahead and say, or generally, we would say that we actually want the patient themselves to consent. So we would rather have um, voluntary euthanasia over involuntary euthanasia. And then, thirdly, it's going to be that their condition is causing suffering which can't be cured. In some more liberal areas of the world, they'll say which can't be cured, like Belgium. They'll say which can't be cured by some sort of medical procedure uh, or care that the patient would take. So it may be the case, like in Belgium, where they may have one option which could take away from the suffering, but for whatever reason, the patient doesn't want to go through with that. So in that case, in Belgium, they would consider that to meet their requirement. But these are kind of the three very common requirements which we would say need to be met in order for euthanasia or for euthanization to be permissible. Um, or at least people who are broadly for euthanasia would say so. Let's go into arguments against euthanasia, very common arguments um, against euthanasia broadly. And there's going to be the first set of reasons, which we're not going to talk about much, which is going to be religious reasons, um, or reasons for the sanctity of life. Most religions, specifically the Abrahamic religions, right? So Christianity, Judaism, and Islam, they believe that there is some sort of inherent good to life itself, and that taking that away would be doing some sort of wrong. And this has informed, um, this has major political implications, right? Because Christianity, especially in the United States, right, carries a lot of weight because a lot of voters are Christian, a lot of politicians are Christian. So part of the reason why euthanasia is broadly not legal in the United States is going to be because of religious reasons. I kind of want to bracket these off to the side here. Um, because, in order to come up with a religious argument or to justify a religious argument, we'd have to get into arguments about what religion may or may not be correct. And that's just very outside the scope of this class, of course. Um, the second type of argument is what's known as a slippery slope argument. And this is pretty much what this means. It means that if we allow euthanasia in some cases, then this is going to essentially lead people to accept euthanasia in other cases, in other cases, in other cases, until we eventually get something that's impermissible. Um, think about the classic children's book, To Give a Mouse a Cookie. People often think that slippery slope arguments themselves, right? Because they're slippery slope arguments outside of the euthanasia debate. This is just a very common type of of argument. People oftentimes consider these to be fallacious, meaning not good or kind of tricky in some sort of sense. Um, and there are a lot of slippery slope arguments. This is my view, right? But there are a lot of slippery slope arguments which are obviously fallacious, which are obviously bad. For example, I remember back in the early 2010s when there were commonly debates about whether gay marriage should be legalized. The sort of like classic, ridiculous, slippery slope argument you would hear would be something like this. Well, if we allow gay people to get married, then we're going to stop taking away requirements for marriage, and then eventually we're going to allow people to get married to children or get married to their dogs, right? I mean, this is an argument that's been widely mocked. It's obviously silly. Um, but there are some slippery slope arguments which are actually quite good, right? To give like a very historically relevant argument, or which maybe are cogent in some sense, or a historically important argument. Think about the beginning of World War II. So World War One ends. The Germans are not allowed to build their military anymore due to the Treaty of Versailles. And then Hitler comes to power, and the Germans start building their military. And the Allies, especially the British, they were thinking like, well, okay, some people were essentially saying, well, if you let Hitler build his military, then he's going to invade a country. Um, and then that happens, and he does. And then people say, okay, well, if you let Hitler invade Czechoslovakia and you don't respond in some way, then he's going to invade Poland. And then he does. And then he invades France and stuff like this, right? So there's some examples where slippery slope arguments, at the very least, turned out to be true, but where they're maybe justified. So why would we think that this is maybe a slippery slope? Well, we see this in some places where they've maybe started laxing the requirements for euthanasia. Belgium is one of the most important cases, right? So, one of is probably the best example. In Belgium, they have taken away the requirement where the patient needs to be terminally ill, and they've actually extended it to include instances of mental suffering, right? Uh, and instances of like relatively common mental disorders. For example, there have been people in Belgium who have sought out and been approved for and gone through with euthanasia for depression and for bipolar disorder, and other instances which we, in general, would hold would not be good because they're not terminal conditions. They're probably not going to lead to the death of this. And I mean, you can kind of see, I think that this is wrong personally. Like, I'll put my cards on the table here. I'm not opposed to saying this. It's generally considered in psychiatric health that suicide is not a viable option and it's not a solution. Um, but you can kind of see how someone who would support euthanasia with these common requirements could use the same principles that we take, like the principle of autonomy and beneficence, which they use to justify euthanasia very broadly, to say, well, no, we should extend this to patients who don't have a terminal condition. I want to talk about this a little bit later. But there are also instances now where euthanasia or involuntary euthanasia would be approved for infants, or there are people who argue that euthanasia should be approved for infants who have terminal illnesses themselves, like terrible terminal illnesses themselves. There are some conditions where if an infant is born with it, it is going to live maximum of 6 months, a year, maybe, right? But it's going to be in constant agony. And people will essentially say, well, it's obviously terrible to have an infant, someone that can't even really understand what's going on, live with this terrible condition, and it would be better to just go ahead and let the patient die peaceful death early on. Um, at the, approval of the parents and the doctors and any other relevant decision maker. Now you can maybe see if that becomes legalized or if that becomes accepted, and if we are allowing um, patients with mental conditions and non-terminally ill patients to be essentially to go through with euthanasia, then you could see how it maybe be a couple steps away to start letting parents go through with euthanasia with their children who have some sort of non-terminal mental condition. Or at least this is the view that some people say, right? The worry is okay, so we let parent or we let people who are just severely depressed go through with euthanasia, and we let infants go through with euthanasia in with terminal conditions. Um, well, why would we leave the terminal condition requirements on the infant and not the other person? I mean, I think there's good reason to do so, right? Because I think consent's very important, but this is the slippery slope argument that people will argue. And then we can imagine instances where people are euthanizing infants for non-terminally ill conditions or for cognitive or mental disabilities. And I think that the vast majority of people would go ahead and say, well, that's clearly terrible. We can't allow that to happen. Um, so this is kind of the slippery slope argument. There are other arguments, right? So I talked about this earlier while I was going over the principle of non-maleficence, but we could say the physician's duty. We may think that physicians have a unique obligation to heal patients rather than to kill them, right? Um, this seems to be like a common view. It is important to note that there's plenty of care which physicians give to patients, which isn't actually healing them, right? It's maybe treating symptoms or treating pain, but it's not actually healing them themselves. But maybe we could say, like, well, the physician's duty is just to uh, uh, improve the patient's health, whatever that means. I find this argument to be rather unconvincing. Um, and the reason why I find it to be unconvincing is because we as a society are what determines what duties we put towards people in what roles, right? Now, we could grant people duties, which would be unethical, right? For sure, we could do that, right? We're not moral relativists here. But if it turns out that it's just always been the case that the physician's goal is to heal a patient, right? There's no reason why we should think that that is like a universal duty that couldn't be changed. So I personally find the slippery slope argument to be more compelling than the physician's duty argument. There are also other arguments, right? For example, worries about mistakes or pressures, right, that may be made in the care, right? So physicians make mistakes. Everybody has heard some story about someone who was told that they only had 6 months to live, and then lived for years after that. Um, People worry that there may be external pressures which are put onto patients. For example, a patient may not want to die themselves, but they may be worried about the toll which it's going to take on their family, and people may think that that would be an illegitimate incentive for somebody to go through with euthanasia. Um, Now, like, I'll put my personal opinion like on the table here. I generally think that there are obviously cases where euthanasia is permissible. Um, I take that to be true. I'm not trying to impart my views onto you guys. I just want you guys to know where I'm coming from. I think that there are obvious cases where euthanasia is permissible. I feel the same way about abortion. The cases which really interest me or the topic that really interests me is, okay, let's assume that this is permissible in some instances. In what instances would it not be permissible? What are sort of the gray areas? You can think about gray areas for abortion, right? We talked about it with this last lecture. They're going to be gray areas or really important questions for euthanasia. And I kind of want to go over this. So let's just assume, like, no matter what you have, what your view is, let's put on the general pro euthanasia hat. And let's say, what are some of the side issues? What are some of the things that we need to resolve to figure out exactly when euthanasia is permissible and when it's impermissible? And the first question, right, which we've talked about before, is whether or not it has to be terminal. Um, this is a really interesting question. People will say, well, if we're allowing people who are dying to essentially end their suffering and die peacefully, and they're only going to live a few more years, however long it's going to be, why would we not let someone who's going to live 30, 40, 50 more years die peacefully? And there's some sort of compelling argument for that, but then we kind of get into the slippery slope territory. And I also do think that people instinctively have the belief that it would be wrong to kill somebody unnecessarily. Um, People generally believe, you don't have to have some sort of religious view towards the sanctity of life, but people generally believe that lives are important, and it would seem to make sense to essentially say lives are important. So it would be worse to kill someone who has 40 years, even if it's 40 years of pain, than it would be to kill someone who has 2 years, 2 years of pain. Um, but you can probably see why this is contentious. And to some extent, even though a lot of people will think that Belgium, right, has gone too far and other countries have gone too far with their very liberal euthanasia laws, you can see how that ethical argument could be made. Okay. Here's another kind of side issue, which we've talked about. Does Can mental suffering justify or permit euthanasia or physician-assisted suicide, right? Um, and I think a lot of people's opinion on this is going to depend on the mental suffering. Um, a lot of people are going to go ahead and say something like mental suffering due to something like depression or bipolar disorder or major depressive disorder or you name it, right? That is not going to permit euthanasia. And in order to say that, right, which saying that would seem to be aligned with the general viewpoint of most psychiatric health experts in the United States, right? In order to say that, they would need to make the distinction between or justify why mental health, right, and why mental suffering would be uh, 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 less permitting of euthanasia than physical suffering. But you could also go ahead and say that there are some forms of mental suffering which can justify euthanasia. So, for example, in um, the situation, or sorry, the when Peter Singer he gives the data which shows the reasons why people go through with euthanasia. One of the examples is, or one of the reasons why people commonly go through with euthanasia would be loss of autonomy. And you can think of of autonomy as which um, something which is actually more indicative of mental suffering than physical suffering. Um, that's maybe more of a gray. I mean, I'm not sure if I would put that under mental suffering or physical suffering. It seems to maybe be in between. But you could see how maybe somebody could say, well, some mental suffering, like suffering because of the loss of autonomy, can permit euthanasia. Now, regarding instances of, or why things like depression or bipolar disorder can't permit euthanasia, in my opinion, one of the main reasons is that the prediction of whether or not someone is going to be able to recover from depression or well, depression especially, right? Or is going to be able to live a good life with some sort of severe mental illness like schizophrenia or bipolar disorder, um, that is much less reliable than the ability to predict whether or not someone is going to be able to live a good life when they have some sort of physical ailment. There are more instances of someone who has some sort of seeming life, kind of some mental disability or some mental problem, which is going to persist throughout their life, actually getting better. Then there are instances of people who have seeming physical problems, who are told this is going to persist throughout your life, getting better. Um, and it may be the uncertainty associated with whether or not someone is going to be able to recover from depression that makes it so that depression cannot permit euthanasia. All right. One other question, right? One other side issue, which I think is really important, is what about children or people who are not fully autonomous? We think that children have some level of autonomy. Um, Children can make some decisions, but we understand that their cognitive capabilities are going to progress, and are going to improve over time. So we don't want to hold them fully autonomous. And the question is, would it ever be justified for someone in one of these camps to make a decision, maybe with the approval of their parent or guardian or next of kin or something like that, to make a decision to go through with euthanasia? And the argument against seems to be kind of simple, right? Which is, well, no, we need consent. We need autonomy. Um, at the same time, it seems to a lot of people to be very dark to go ahead and say, oh, well, an adult patient who is only going to live a year and is going to live a year in constant agony. Well, we're going to allow them to die peacefully, but we're not going to allow a child to die peacefully. If euthanasia truly is offering a good to somebody, right? If it truly is offering a good death, then why wouldn't we want that benefit to go to children? And this seems to become a pretty difficult issue. I think that this is a massive dilemma. But I also do believe that allowing euthanasia for children, um, I mean, it seems very intuitively wrong, um, but it also opens up the door to slippery slopes. I truly do believe that. Um, One sort of side issue, which I think is incredibly important, is whether or not there is a moral difference between killing and letting die. And we actually talked about this a little bit in the abortion lecture. Um, Now, it's important to note that people can already choose to not have treatment. Someone who's diagnosed with cancer, even if it's probably curable, it is well within his or her um, right to decide whether or not to go with the treatment or not. Um, and in some sense, this could be seen as um, an instance of passive euthanasia, or at least decided by the patient themselves, or equivalent of an instance of passive euthanasia. Um, so in one sense, right, we already believe that there are instances which don't seem problematic at all, which aren't even really questions, where something which is just essentially akin to letting die uh, is permissible. Now, I think that's because we value autonomy and we don't want to force people to get medical care. We don't want to kind of be in a very paternalistic medical system like this. But we can think about the difference between a doctor letting someone die, right? A doctor who's already caring for a patient letting someone die, and then the doctor killing them themselves. Is there a difference? It seems like a lot of people have the intuition that there is a difference. And this is going to be the reason why we have physician-assisted suicide, meaning the doctors will supply the patient with the materials and the ability to do so, in many places where full-on euthanasia is not legal. This is the case in Colorado, actually, where physician-assisted suicide is legal in some cases, but euthanasia is not legal in any cases in Colorado. Um, I personally find the distinction between the doctor injecting a patient and the patient injecting themselves after being given some sort of drug from a doctor to be rather confusing. I'm not sure if I see a significant difference. I do think that there is intuitively a difference between a doctor unplugging somebody from life support, and a doctor injecting a patient with some sort of lethal medication, which will kill them. Now, justifying this difference, right, is a different story, but we've already gone a bit long here. So I think I'm going to end it here. I think this is a pretty good overview. Okay, thank you.